How do I safely return to progressive strength training postpartum with pelvic floor dysfunction? Imagine feeling eager to get back to your workout routine after having a baby, but your body still needs time to heal. That's completely normal, especially if you're dealing with pelvic floor issues. Returning to strength training too soon can cause more problems or slow down recovery. So, how do you do it safely? Let's walk through it step by step. First, understanding pelvic floor dysfunction is key. It can cause symptoms like urinary leakage, pelvic pressure, or discomfort. These happen because pregnancy and delivery stretch and weaken the pelvic muscles. Jumping into heavy lifting or high-impact exercises too early can make these symptoms worse. Patience and proper care are essential. In the first few weeks after birth, focus on gentle healing. Start with diaphragmatic breathing. Breathe deeply to let your pelvic floor relax on the inhale and gently engage it on the exhale. This helps improve circulation and reconnects your mind to your muscles. If you feel ready, do pelvic floor exercises, often called Kegel exercises. Begin with short holds and releases, making sure not to hold your breath or tighten other muscles. If you had complications like a catheter, wait until your healthcare provider clears you. Next, incorporate light movement. Short walks are great for boosting circulation and preventing blood clots. Pay attention to your posture, especially when feeding your baby, to avoid strain. When lifting your baby, engage your deep abdominal muscles and pelvic floor, exhaling as you lift. Simple exercises like pelvic tilts, glute bridges, and heel slides help retrain your core and pelvic muscles without overdoing it. Around 6 weeks postpartum, most women can start more structured exercises, but always check with your healthcare provider first. Begin with low-impact activities like modified planks, bird dogs, and gentle squats. Focus on proper form and control, not speed or weight. If you notice any pain, leaking, or heaviness, scale back and consider consulting a pelvic health physiotherapist. Once you've regained basic strength and your symptoms stay stable, you can gradually introduce progressive strength training. This means slowly increasing resistance, repetitions, or complexity of movements. During lifts, always engage your pelvic floor and core. For example, exhale and gently draw in your pelvic muscles when lifting weights. Avoid exercises that cause bearing down or increase intra-abdominal pressure too fast, like heavy deadlifts or jumping, until your pelvic control improves. Pay close attention to your body. If you notice increased leaking, pain, or pressure, reduce the intensity or modify the exercise. Keep pelvic floor exercises in your routine even as you progress. Over time, aim to hold positions longer and do more repetitions, but never sacrifice proper form or comfort. Some practical tips include starting every workout with diaphragmatic breathing and pelvic floor activation. Progress gradually, adding resistance only when you feel ready. Mix in mobility, strength, and low-impact cardio to support your recovery. Use bands, lighter weights, or modify movements as needed. If symptoms persist or worsen, seek guidance from a pelvic health physiotherapist. Remember, returning to strength training postpartum with pelvic floor issues takes patience. Focus on healing first, rebuild your foundation carefully, and progress at a pace that feels safe. Your pelvic health is the foundation of your fitness journey. Respect it, and you'll build strength that lasts for years to come.